So Dr. Smith, what percentage of people who have Lyme disease will continue to have some symptoms after 6 months?
That's a good question. There are a number of studies now that have looked at the resolution of Lyme disease with antibiotic treatment, and about 10 to 15% of people a few months out from treatment are still not back to their baseline. They may be fatigued or have continued achiness and just aren't back to where they were. They don't have the symptoms usually that they presented with, such as the rash, or if it's a swollen joint or whatever the finding was that caused them to come in, but they're not fully back to baseline. Over time, most people do recover completely following treatment of early Lyme disease.
Yeah, I think I completely agree with that. I think what I'd like to add as a rheumatologist, seeing people who have symptoms of pain, arthritis from many different causes, something like a systemic infection like Lyme disease can do a number on the body. And I think that not just with Lyme disease, but other infections, other events that make people ill, we sometimes have to appreciate just how long it can take for the body to recover. And so I see these patients, just as you described, people who most do feel better pretty quickly, but the ones that don't, they may have fatigue or aches and pains, or just feel like their head's not working quite right. I try to reassure people that they will gradually improve with sort of healthy living, exercise, eating right, doing the things that are good for all of us. And I really think people then will continue to improve and generally get back to themselves, and in the majority of cases there.
Has there been anything that's been scientifically proven to speed healing in patients who continue to have symptoms?
You know, it's been hard to do studies. Everybody's a little bit different who doesn't feel well after having had Lyme disease. I do think, again, maybe from the rheumatology viewpoint, we see patients that have these kind of symptoms from many different causes, and really is the combination of attention to physical well-being and emotional well-being. Just try to do the things that we all know are healthy in terms of a well-balanced diet, good sleep habits, attending to stressors that might be there, and kind of having that faith that if you keep doing that, there's just an excellent chance that you will emerge and get back to the way you were feeling. But it's hard to find good, validated scientific evidence, for exactly one way to do it. I think it's different for each person, what they need to do or what helps them the most.
Great. Well, thank you both. So, Dr. Smith, there's a lot of information on the internet floating around about long-term treatment of patients with persistent symptoms with antibiotics. What do you think is the scientific evidence to support this?
There really isn't scientific evidence to support prolonged courses of antibiotic therapy once appropriate treatment has been given. There have been looks at this with randomized controlled trials, which are probably the best way to find an answer. And several of these studies in North America and one in Europe have shown more adverse effects from antibiotic treatment when looked at than any benefit. So overall, the answer on that has not been encouraging, and we have no evidence that that's a useful strategy.
Yeah, I think I would add to that. I've seen many patients over the years that have been through that, in wanting to be better, which is completely understandable. They still feel poorly after Lyme disease for a while, as we've talked about before. They're seeking to get better, and they've been on the antibiotics for months, sometimes even longer. And yet I see them, and when you really comes down to it, they're still suffering from the same symptoms in spite of that, and often have suffered side effects of antibiotics. So I think people definitely need ways to try to overcome those symptoms, but I think that the antibiotics often lead to more trouble, and to redirect and again think of other things to treat the symptoms for physical, emotional health is probably the much more productive way to go.
Thank you both.